OK. Well, we seem to be heading into another crisis for NHS dentistry in the southwest. It's nothing new, of course. Patients have been struggling for years to get treatment they are, in theory at least, entitled to. This BBC News item was filmed 45 years ago.
Do you think there's a shortage of dentists in this area?
Yes, there is.
Do you yourself have difficulty in seeing one?
Yes.
Why do you say that?
Because I've been 3 times to try and get on one for National Health.
Do you think there's a shortage of dentists in this area?
Yes, I think there is. When you come into the area new, it's quite difficult to get fixed up with a new dentist.
Do you yourself have any difficulty in seeing a dentist when you want to?
Oh, well, you have a bit of difficulty. There's always quite a good waiting list.
Golden age of television. But it seems things are much worse now. In Cornwall, there are reports of people waiting for up to 3 years to see a dentist, and one complaint to a health watchdog from a man who says he was forced to take out his own teeth because no help was available from the NHS. Local dentists say the government must address the crisis urgently. Tamsin Melville reports.
Open wide, the familiar sounds of a trip to the dentist. But there's a stark warning about the future.
We're actually at that position now where we're asking the question, does dentistry even have a future in the NHS? That's totally unfair on patients who pay their national insurance and they should be able to access high quality NHS care.
We've got a patient with a lack of access to dentistry, another individual struggling to find an NHS dentist there.
It seems getting access to an NHS dentist is a growing problem in Cornwall.
Anger at a waiting list.
At the county's health watchdog, staff say it's the #1 issue people are getting in touch about, with a noticeable rise in complaints in recent months.
So we've heard stories of people waiting over 3 years for an NHS dentistry place. Stories of one lady who's going to move out of county because she can't access NHS dental care for her autistic son. And another gentleman who actually contacted us because he'd been driven to take his own teeth out.
Healthwatch Cornwall's launching a survey to get a wider picture, and their patient feedback comes as no surprise to the British Dental Association, or BDA, which says NHS dentistry is increasingly a postcode lottery. The latest data suggests patients in several major towns in Cornwall, Penzance, St Ives, Falmouth, Newquay and Bodmin, would face round trips of up to 65 miles to the only potential practice that's accepting new NHS patients. That's in Redruth. The BDA blames an NHS system set up in 2006 which caps the number of patients a dentist can treat. It says the contracts don't pay enough and there's a problem with recruitment. If targets aren't met, money is clawed back. In 2016 to 17, that clawback totalled around £4 million across Devon and Cornwall.
Dentistry in Cornwall is running on fumes. Dentistry has always been the poor relation of medicine. It's never really been properly funded, and that funding just got lower and lower and lower. And now we're in a situation where, with the funding being cut even further, it just doesn't have enough importance to the government for them to take it seriously. The 10-year plan for healthcare came out. High street dentistry didn't even get a mention. So we have to ask the question, when is he going to sort it out?
The Department of Health says it is committed to improving oral health as part of a wider focus on prevention within the NHS long-term plan. And it says NHS England is currently working closely with providers to improve access to local dental services.
Lovely. How are you doing there? You okay?
Fine. Including looking closely at the recruitment and retention of dentists.
Charlotte, it seems the root of this problem lies back in 2006, when, of course, Labour were in government.
Well, I can't comment on the situation in Cornwall, but I do know that last year we saw across the country a rise by 50% of children that had to wait over 6 months to get a dental appointment across this country. Now, these are staggering figures, so we do need to look more closely at this. And I think the person on your reel there was right to highlight that it's something that we would have liked to have seen addressed in the NHS 10-year plan. What I see in Plymouth is that people are raising this with me on the streets, that they are finding it difficult. I've been in contact with the Cabinet member in Plymouth City Council to see what we can do to alleviate some of the pressures on dentists in the city. But you know, it's also really important to note that it's not just access to dentists that can be a problem. It can be a whole complex range of health factors around that. You know, good oral hygiene can be connected to the issues around obesity, overconsumption of fizzy drinks, lots of things like that we need to be thinking about.
Steve, you're Cornish MP. You're also the party in government, just. What should be done about it?
Well, I think, as your clip there highlighted, my understanding the biggest challenge in Cornwall is around recruitment and retention of dentists, that we do have a problem across, actually, the health sector in terms of recruiting and retaining good
Potentially back to Brexit, of course, as well, because we've got an awful lot of dentists coming across to the EU who are saying they might go back.
And that's why we need to make sure we get our immigration policy right post-Brexit. You know, it's something that I've been working on very much. But I do think there is an issue I'd encourage the government, the Department for Health and NHS England to look at around this cap that does seem very arbitrary and doesn't allow dentists to treat people that need treatment and put them on their books. So I think the system does need looking at, and we need to make sure that we're recruiting enough dentists in Cornwall. OK. Thank you to both my guests. Fed up with saying it's another momentous week at Westminster. It is, as we see the Prime Minister having a second go at getting her deal through the Commons. I'll see you on the other side next week.